everybody shows up once a month, and they represent hospitals, the homeless community, law enforcement, judges, EMS, and you name it. And they're all there. They come voluntarily, by the way. When we first started, they didn't come voluntarily because we got the county judge and a probate judge to invite them, and we took good minutes, and they had to show up. But once they started believing it, people show up because they have their own particular interests. The chronically and persistently mentally ill in this state die at least 25 years sooner than the general population. In our state, it's 29.4 years sooner. They never get to primary health care. They're self-medicating with alcohol and drugs. A lot of them are smoking because it kind of eases that tension. Yeah, the tension that they have. And so they're not dying of their mental illnesses or their substance abuse. They're dying of congestive heart failure and liver disease and all these horrid things. So what do you think's driving up the cost of healthcare in the United States? Malcolm Gladwell wrote a story for the New Yorker where he talks about $1 Million Murray, about this young guy who dies early, but he costs $1 million and he's unfunded. So this hospital has to raise their charges to help offset the cost. So there's this very small group of people that have co-occurring disorders, mental illness and substance abuse, who never get to primary care. And that's the reason we're talking about integrated care. And when people come to our sobering and detox unit, once we get them sobered up, we find their underlying emotional disturbance or their mental illness. When they come in our mental health crisis unit, we get them stabilized mentally. We find out they've been self-medicating with alcohol and drugs. So co-occurring treatment is very important, and you guys are really on top of that. And bringing primary care in is real important. I actually had a project with a qualified health center in one of my big outpatient clinics to try to integrate primary care with behavioral health care. It didn't work very well because they had their rules and we had our rules, and even though we were in the same location, they were still siloed. And the director of that program met with my executive medical director, Dr. Milam, who's this phenomenal psychiatrist, and he says, we can't have this, and Dr. Milam says back to this good doctor, why? He said, your patients are going to our other clinics. And so she said, well, probably because they're members of your program, they probably live closer to your other clinics. He said, but he said, they can't go. And she said, why? She said, because your patients are weird. They talk to themselves. They have hygiene problems. They scare these mothers, the others. And they actually pulled out of this project and divorced themselves with us. And so it just dawned on us, we love these people. We care about them. We're hiring 60 peers this year. And people that have life experience are in recovery. You're talking about good motivational engagement and getting people to treatment. They're magical in helping them maintain their treatment is great. So the cost of the healthcare system is driven up by these folks. Probably 30 to 35% of the people in your county jail have a mental illness. A huge percent, 65% are arrested for alcohol, drug related crimes, right? And so in Bexar County, in 2002, the Jail Standards Commission was threatening to shut down our county jail for overcrowding and deplorable conditions. They contracted with other counties to get the population down, so that didn't happen. There's a federal judge that started to look over their shoulder. They brought in an expert that said you need to build another 1,000 beds on the detention center right away. We had started training law enforcement officers the year before, and we developed our first little crisis unit. Well, we grew by 500,000 people over this last 10 years, last census, and just last month, we never built the additional 1,000 beds in the county jail. We had 900 empty beds in the county jail. Our sheriff, who's a retired 2-star general, she not only has all her deputies trained in the 40-hour training, but her jailers, because she wants them to use verbal intervention before any kind of force in jail. Chief McManus, her San Antonio police chief, requires all his officers to be trained. He won't let you carry a taser unless you've been through the 40-hour training, because he usually wants you to use verbal intervention before force. 95% of the 6,000 certified police officers in our community are trained in that second intercept model. So what we do is train officers to recognize signs and symptoms of mental illness. If you haven't committed a major crime, they bring them to this restoration center. Just drop them off. I can talk about the savings, but we keep a lot of that on cost, and the savings to the city, the county, the hospital districts, the number of people in emergency rooms with Google the cost to taxpayers of the homeless, you'll get all kinds of studies. The cheapest I saw was $30,000 a year. The most expensive was a study done by the Scripps Center in San Diego, where they looked at their high utilizer program. This is several years ago. Their high utilizers cost the county $120,000 a year. They have lots of contact with law enforcement. They're in and out of jail. They're in and out of emergency rooms, and they're very, very costly. And they have these horrendously sad and painful lives, and they die early. And so I want to tell you this little story that I can prove that treatment works. And how I do it is through the data through the Texas Department of Criminal Justice. So Texas has this very conservative think tank. It's called the Policy, I just forgot it, Public Policy Foundation of Texas. So it's funded by some very rich conservative people. And they have this whole division where they've collected data. It's called Right on Crime. Right meaning conservative. And so they have this data that proves if you fund these services for people with mental illness, it actually improves the public safety net and saves the taxpayers a lot of dollars. So I would encourage you to go look at Right on Crime and the data they have. They use a lot of our data, but they use data of the Texas criminal justice system too. And actually, we shut down 2 prisons in Texas. So back in the late 60s, early 70s, there was a class action lawsuit against our prison system, the Ruiz case. And I'll do it kind of quick because I know people want to go, but our prison system was almost a profit center like a lot of Texas prisons. We forced the prisoners to work. They made all their own clothes, grew their own food, repaired school buses, made license tags, made furniture. They hardly had any employees. They used the building tender, so they took the biggest, meanest SOB on every cell block and put them in charge. And if they kept the peace, then they got good time or special consideration. The problem with that is how they kept the peace was through intimidation and violence. So there are a lot of wrongful deaths. They had no medical services. So if you're in prison in Texas, you had cancer, you just died this horrid death. So make a long story short, part of this resolution settlement, the federal judge was William Wayne Justice. Great name for a judge, right? And so Texas agreed to build a whole bunch of 1,200 bed prisons, brand new ones, and staff them with professional staff and have medical services. And they built extra capacity codes. We're a law and order state, right? The problem with that is the bill came home and those extra prison beds started filling up real fast. And so the legislature really started getting concerned about, having to build more of these prisons. So they turned to their researcher, a guy named Dr. Tony Fabello, and they said, Dr. Fabello, tell us how come our capacity has been used up so fast. So Tony took his research staff, went and looked at the prison population, and published a report for which our governor promptly fired him for, because he said, you all are stupid. And his report basically said you have a lot of people in prison taking up space for violent offenders who shouldn't be here. And mentioned 2 groups specifically: non-violent, mentally ill offenders, okay, felons. But they were, like the judge said, they weren't in danger themselves or others. And people that were terminally ill. Of course, you can't be on Medicaid if you're in the prison system, but you can if you're in a nursing home. These people were so incapacitated they wouldn't be in danger. So even though they fired Dr. Fabello, they took his recommendation and they developed a new branch of the prison system. It's called the Texas Commission on Offenders with Medical and Mental Impairments. So when it first started, that staff would go through the prison system, identify these non-violent, mentally ill felons, and put them on parole. The condition of their parole is they got to see my doctor, they got to take their medication, they got to do their alcohol and drug screen if so ordered, and generally stay in compliance with their mental health treatment. Okay, so felons on parole, 4 to 6 years out, 4 to 5 years out, 3 to 5 years out, revocation rates are 40 to 60%. If you have a mental illness that's untreated, it's even higher. In other words, you get rearrested and go back to jail or prison. Guess what it is in Bexar County if you get treated? 6.6%. That's not my number. Those are the numbers that come out of the criminal justice system. We actually co-locate with adult probation. Most of those are technical revocations where we round the person up, we get them back in to treatment. It's so they don't go back to jail or prison. So treatment works. A lot of these people are treatment resistant. Some of your family members know this. They don't even know they have mental illnesses. They're self-medicating with alcohol and drugs. And so we do have the outpatient commitment process. So a lot of these young people and even older people whose illness has been so painful for family and friends or estranged, we have a process on the civil side where we can get them in front of a judge. And in Texas, it was fashioned after Kendra's Law in New York. But we watered it down in Texas. You had to have 60 consecutive days at the state hospital to be eligible for the intensive outpatient commitment. So we worked with our civil judge, and we started this program. And I sat in her court before, and she would, I'm the person to say, Leon, you've been in and out of my court several times over the last few years. Your illnesses have been so painful for your family and friends. You're estranged. You don't have a good life. I'm going to assign this lady that works for me, Mary Helen Lopez, to work with the Center for Healthcare Services and develop you a specialized plan, and I expect you to comply with it. And so, anyway, we kept at it. Like the judge said, we keep data on everything because we have to prove our case. And by the judge, that black robe effect, by the judge standing up there saying, I care about you, but I expect you to comply with treatment, 67% reduction in rehospitalization with this group that spent almost all their life in state hospitals. So on our intervention points, we did first line intervention. We now have a program where we're working with the Council of Governments, Fred Usher and other folks, where we've got all the law enforcement officers in Bexar County has 5 questions when they arrest somebody. It has to do with mental illness, the kind of medications you have. The county hires me and my staff at Bookend to do mental health assessments, and our staff also have access to the Texas care system. So if you've ever been treated in a state hospital or community mental health system in Texas, we can look you up. We also do, as the judge said, that dangerousness assessment. So and this is before you go to jail, it's at Bookend. So if you're mentally ill and the assessment is low for you to hurt yourself or somebody else, we're getting with the magistrate and say, will you do a conditional release? A personal recognizance bond or mental health bond or whatever, and say, we're not gonna put you in jail if you go to treatment. And so that's just now kicking off. It looks really good. We also support the veterans courts, the drug courts, the mental health courts, and the children's courts, and provide the therapeutic services. They're the active ingredient. It's really the therapy, but the judges, are getting people to treatment, and then they, as the judge says, they get lucid and they really do well. We also developed one of the first curriculums in the United States for school police. And so we have a children's crisis unit, and you just saw the slam guy, right? And this used to happen a lot in San Antonio. We get a young officer just right out of academy, trying to use their command voice and command presence. A teacher calls up and is very, very frustrated, and he or she, the tone in their voice when they talk to the officer is, I want you to come and get this kid, and I never want to see him again, because the kid's really been active. So you've got a kid that's emotionally disturbed or mentally ill, full of hormones. You get this young officer rushing up to him, getting in their face, using command voice, command presence, or some kind of altercation. So they go to juvenile detention. At best, they get kicked out of school, get estranged from school. That doesn't happen now. These officers will realize these kids have problems. They step back, they use de-escalation techniques. They call their parents, they call us. We get them to that children's crisis center where they get a good psychiatric evaluation. Only about 18% of them need to be hospitalized. The rest of them can go to other kind of treatment alternatives. That stuff really works. But again, I appreciate your leadership. And when people come, again, what they say is, how'd you get everybody to work together? And it's the community coming together, developing your own plan and getting invested and keeping a lot of data on what's working and not, and having that continuous quality improvement environment so you can keep tweaking it.